or your loved one recently visited a hospital? Imagine going to a hospital and being greeted by a robot. Will you be surprised? Well, you should not be, because this is not science fiction anymore. And today we have someone who is sitting at the heart of this transformation. He is the Group Vice President of a leading hospital chain in Delhi. We have Dr. Karan Thakur with us. So Karan, tell me, how has AI been integrated into healthcare systems in India or across the world?
Yeah, thank you, Devika. Thank you for having me. I think AI presents the greatest transformation that is going to be seen in this century for the entire world. And healthcare is no different. As you know, healthcare is becoming more technology dependent. There is digitization of healthcare. There is massive amounts of data that is being generated, and it is starting to reach the masses. So once you have that expansion, it's obvious that AI will have a lot of interventions for the benefit of healthcare. Now, today, if you see, while AI is a new field that we are talking about, but AI has been in healthcare for a very long time. If you go back to how cancer screening was being done, at that time, the IBM company came out with what was called IBM Watson, which looked at a lot of various diagnostic information of cancer patients, and then could actually pinpoint and help the doctor identify which type of cancer it may be. So helping in differential diagnosis. It's not this, it may be that. And this was close to about a decade and a half ago. So that was the real first step. Today, if you see AI, and I'm not just talking about generative AI, I'm also talking about the technology which is embedded into systems, is being used in India for the National TB Elimination Program. It is being used to identify TB nodes in patients just looking at their X-rays. So the AI can read whether this patient might be positive or negative for tuberculosis. And we know tuberculosis is a problem of the masses.
Yes.
So it is helping in mass screening. Similarly, AI is being used very extensively to predict a future event that you may have. It could be a cardiac event or a stroke. Okay. Just looking at your current and previous history and saying, if you go on to this pattern, it is likely that you might develop a cardiac event in the next 5-10 years. So that is empowering doctors, but it's empowering patients also, because today they know that I better make sure that I get my health in check, because this is what the reports are suggesting. Third is, we are seeing integration, like you rightly pointed out, about robotics. So there is an automation that is also going on, and that also has some bits of AI which has come in. We foresee that in the future, as robotics becomes more and more important, you will have AI sitting within the robotic unit and helping guide surgeons to better navigate and give better outcomes. So there is an entire spectrum of activity, whether it is diagnosis, whether it is differential diagnosis, helping in that space for doctors, clinical decision making. As a doctor, what should I do? I have two options now. What can I do? And third is, sitting inside technology itself. And for patients, this is also going to be very, very useful. Today, we know that wearables has become very big. Everybody is monitoring their health, which is a very good thing. But how do you analyze that data, and how can data then be used to trigger an alarm that something may be wrong or may be going, the wrong way? And that, AI has a huge role to play. So a lot of positives, but then there are areas of concern as well, which we'll touch upon.
So have you come across any recent case related to doctors or patients where you could see these challenges and opportunities?
Yeah, I think opportunities we are seeing on a day-to-day basis. If you go into any hospital today, any big hospital, they are using in their preventive health checks some bits of AI, some bits of data churning, which will help them identify कि इस patient में ये problem हो सकती है या stroke का chance बढ़ रहा है. At my organization, we worked with one of the leading technology firms in the world, and with them we have a predictive score now. So, आपका heart score, heart risk, cardiovascular risk score, we can tell you just basis on your parameters, and we are measuring that against thousands of patients who have undergone a health check. So the AI is able to tell us कि इस केस में ये problem आपकी आ सकती है, given their age profile, whether they're a smoker or non-smoker, and that is revolutionary. पहले you would only look at the records that were available to you. Here it is able to look at thousands of other records, lakhs of records, and tell you, basis what I can see on this case and my experience, this is the predictive risk score. But then there are risks also. आप देखिए, अगर एक एवोल्यूशन देखें हम ऑफ हाउ इंफॉर्मेशन इज बीइंग यूज्ड, फर्स्ट वाज द इंटरनेट रेवोल्यूशन दैट हैपेंड, एंड फॉर हेल्थ केयर इट वाज डेमोक्रेटाइजेशन ऑफ मेडिकल इंफॉर्मेशन, बड़ी अच्छी बात थी. बट देन द गूगल डॉक्टर केम अराउंड वेयर पीपल वर गूगलिंग थिंग्स एंड without the depth of knowledge, whatever was coming up, they were taking it as good, bad, and in many cases, people were self-diagnosing also, which was
And now we
risky.
have AI search and AI mode.
And then in
So a
between, we
lot
have,
of misinformation out
it is out there. अब आप social media देखिए बीच में आया. Then we have the WhatsApp doctor, where a lot of information was flowing in groups and coming to people who were taking it as reality and using that sometimes detrimentally also. And now we are in the age of AI. So again, technology का जो evolution हुआ है उसमें information is becoming more and more available to people, and now we have the power of you deciding what you want to do through generative AI, because you can say these are my health records, what should I do to lower my cholesterol, let's say. But that advice needs to come with a medical expert also watching over you. So that is the challenge that we now have. How do we make sure that AI, generative AI, is used responsibly?
Right, the power of what you want to do and how to do. But जब हम इंडिया की बात करते हैं, there's a lot of population,
Yeah.
rural, urban, and then there are many other segregations. So healthcare already, we saw in COVID how we were not ready
Yes.
for pandemics, epidemics. We are not ready. So how do you think can we deal with that problem through AI? Is that a solution? Is AI a solution or not in this scenario?
I think AI, it should not be seen as a standalone. अकेले सिर्फ AI cannot solve all the healthcare problems of India. As you expand infrastructure, as you expand reach, as you expand the availability of doctors, nurses, and allied healthcare workforce, AI will need to support that. So अगर आप mass screening देखिए, that is one sure shot way of catching disease early and then doing interventions. Today, India is unfortunately the diabetic capital of the world.
Yes.
It's the heart disease capital of the world. Now, people are only turning up in the hospital or getting a random blood check done and realizing that they may be diabetics or pre-diabetics or hypertensives. But agar hum mass screening kare, we can catch disease early, and therefore people then do not have to undergo that disease itself by preventing it, or at least know what more they need to do. So I think it has a potential to be a very good partner for reaching out to the masses. I think AI can be a tool or it can be a weapon. And it's better if we use it as a tool so that we benefit the masses, especially the rural population.
Especially the rural population. But cost की जब बात आती है, that is a major concern, क्योंकि as per my understanding, AI tools integration, it requires a lot of infrastructure, बहुत पैसा चाहिए to build or buy.
Yeah.
So will that increase the cost, or the regulatory bodies, government of India, should try to bring in certain measures to help the rural masses to get these services? क्योंकि as we said, it's a boon and bane. But boon को हम और कैसे बेहतर use करें? क्या वहाँ पे regulations या कुछ और आने चाहिए?
I think technology, it by itself is a means to reach out to the masses. So उसका advantage हम देख के we should then consider the cost. Number 2, what is the cost of a disease? ये बहुत लोगों को पता भी नहीं है और calculate भी नहीं करते हैं. I mean, the cost of catching something early today for X rupees, and the cost of treating that problem for the rest of my life is, let's say, Y rupees. And when you compare the two, you find it's better to have done X today than Y later. Ab preventive health check dekhiye. Many years ago, when doctors were prescribing preventive health checks, many people thought that this is just a way to get more people to do more tests. But actually, if you caught disease early, you could treat it early or even prevent it.
So did it help? As per the statistics,
it did help. I mean, if you see the national program on NCDs, which is the government of India's flagship program, which is doing mass screening, it is finding many things. It is not only finding things like obesity and all early, it's finding heart disease early. It is finding risk of strokes early, diabetics early. Now, once that happens, we have a young population, and we also know that in the young population we are also seeing these type of diseases faster or quicker for various reasons, and that will lead to a demographic crisis because our working population should be healthy. So catching it early is the only way to do it. Now, it comes at a cost, of course. Like you said, developing an AI tool or developing or integrating that AI tool will cost money. So how does, and frankly, agar aap abhi dekhe, other than development cost of generative AI. How much will it cost per patient? How much will it cost in this technology is still a big unknown. But my vision for AI in healthcare is that it should not increase costs. It should somehow be, built into the cost of treatment itself. But we also have to see the total cost of care versus preventing a disease today. We have to
Right.
look at both those advantages.
My vision of AI in healthcare is very Terminator kind of futuristic. I so wish that I get a chip in my hand and that chip can detect anything that goes wrong in my body. So with AI, probably I would want that to happen.
Yeah.
But I'm sure that is going to take some years.
Maybe not.
No?
Maybe not. Yeah, I mean, if you see, this is slightly different from AI, but if you're seeing where, we are going with targeted therapy for cancers, where you're going for vaccines or immunology for cancers, we are actually now creating technologies which can cure your cancer in your body. So it is getting to that precision. So I think tomorrow's world is happening today.
Do you think with AI expense, the cost will come down for a general user, a patient?
I think eventually, yes. Any new technology, if you see, when it is introduced, yes, there are costs involved. Sometimes costs rise also. But over time, when technology becomes more mass available, and also when technology becomes, available to many developers, we see costs coming down. Take, for example, a blood test or, a battery of routine tests जो पहले 10 साल पहले किए जाते थे, उनकी प्राइस क्या है और आज
5,000 से बहुत सारे 800-700 पे भी आ गए
800-700 पे आ गए एंड इन मेनी केसेस लाइक कार्डियक सर्जरी जो कॉस्ट 10 साल पहले थी वो कॉस्ट आज भी उतनी ही है, बड़ी नहीं. सो आई थिंक वंस इट एक्सपैंड्स एंड इज रेडिली यूज्ड, कॉस्ट्स विल कम डाउन.
But with AI, one another concern that I've heard people talking about is the data and privacy concern. क्योंकि जो उनका data जैसे स्मार्ट वॉचेस हम पहन रहे हैं या अगर इफ वी आर यूजिंग एनी अदर इलेक्ट्रॉनिक मेजर टू कैलकुलेट आवर हेल्थ रिस्क्स और नॉट, तो वहाँ पे वो डेटा प्रिवेसी को लेकर के क्या मेजर्स हैं और क्या होने चाहिए, दैट आई वुड वांट टू आस्क.
If you see healthcare data, other than probably people trying to steal bitcoins, healthcare data is the most cyber vulnerable data because globally it is vulnerable for cyber attacks and for hacking to steal that data. Again, for various reasons, because we have so much data on a patient, right from demographics to where they live to payment details and then various details
and
of
that
their
can be
health.
used again against our insurance itself.
Your insurance, it can be used against you in many ways, and if nothing else, it's a violation of your privacy.
Yes.
And every hospital talks about transparency, but also privacy. Both go hand in hand. So that becomes a challenge, and rapidly more and more data is being generated of each patient, of each procedure, and this data is now being shared also with, let's say, a payer. I am sharing this with the insurance company, or I am sharing this with the patient, I am sharing this with other doctors. The more the number of shares happen, the risk of that data leak or that data being breached increases. But luckily, one must also point out that the laws have also kept up. If you see the new Data Privacy Act, DPDP, it has provisions which makes sure that healthcare data is safe. And healthcare fiduciaries are also responsible for the data. But if you want to share it for research, if you want to share it for medical reasons, you're allowed to do that. So I think that architecture is there, but everybody must be very careful with their own data. And sometimes we find people, wearing wearables without even reading the terms and conditions of
That
where
is
their
the
data.
major problem.
That is the major problem. Scroll down, say accept, move on. But are you giving away your data? Are you giving away your data to be sold? We know that our data is available in multiple places for people to use to do telemarketing and to do other things. But it can be used for sinister reasons also. So be very clear where your data is being used. Just because it is easily accessible through an app or others, questions need to be asked whether my data will remain safe or not, because your health data is very critical.
So what role do you think AI literacy can play over here? How you're also associated with Adira network.
Yes.
So how do you think AI literacy can play a better role in making people aware about these things that we have just talked about?
I mean, take for example, if you're using any generative AI interface or tool. Right? There's so many available. And you're uploading your medical records on it. And you're saying, analyze my blood glucose over the past 2 years.
Everyone is doing this today.
Everybody's doing that
With
today.
ChatGPT happening, everybody's
doing that, and others are trying to do it. And they're using multiple of these to see, ye wala to aise bol raha hai, dusra wala kuch aur to nahi bol raha hai. They're trying to do that. Your data is now available with whichever, generative AI tool that is there. How safe is it? Do you really need to share it? Do I need to share everything that I need? Can I get this information from somewhere else? So your data, you have to start thinking about the sanctity of what I'm sharing also. Because yes, they may keep your, your files and your data safe and secure, but who knows? It's still an evolving field. So my suggestion would be, use as little as possible of your personalized data, your very personal data on these various tools, and get to know how AI works. I think ये एक बहुत बड़ा स्टेप रहेगा जब लोगों को ये पता लगेगा कि AI का जो जनरेटिव एस्पेक्ट है वो जनरेट कर कैसे रहा है. हाउ इज इट रियली, व्हाट इज द इंजन बिहाइंड इट. इट्स वेरी कन्वीनियंट बिकॉज द यूजर इंटरफेस इज सो नाइस एंड ईजी टू यूज, बट समथिंग इज हैपनिंग बिहाइंड दैट. Do I know enough about it? And when you're not sure, don't share your data. I think that should be a very clear rule. And AI literacy will help. Because right now, I think it's a tool. People are using it, for various things, like you're saying. But is it safe to share a lot more of that data that, and you see that in other places now. Today, there are apps which say, allow this app not to track. You go to Google Maps, you're leaving behind, some cookies or trails for people to track you. That awareness has come on the internet and on various apps. For AI, we also need to do the same thing.
And trainings, आपके hospital level पे या जो networks आपके हैं, क्या उसमें trainings actually हो रही हैं?
Trainings start हो रही हैं, but to be very honest, they are very few, and I don't think they are very comprehensive right now. So AI is moving faster than AI training. So I think they need to always be, at the same pace.
Right. And how many years would you think actually, with the India's population, you think these AI literacy and trainings will actually work to match the pace of the technology?
See, I would want to be very optimistic rather than being despondent. If during COVID, with all the the bads that happened, if we could all use COVID app and use it to get ourselves vaccinated across the length and breadth of this country, and we had that awareness, if we can use digital public goods, whether it is e-Aadhaar, whether it is UPI, whether it is so many other things that we now do digitally, the OTP revolution that has happened, that awareness happened very fast. And I think on AI literacy, we can use the power of technology to also reach people very fast. I think we should not be talking about decades, we should be talking about a few years.
Right.
And the other thing about AI is currently it's very English heavy. And I think that democratization needs to happen where it is available to people in
Different
various languages so that they can then become more aware to it. Ab dekhiye, Google Voice was such a revolution because I didn't need to type anything. If I was illiterate also, I didn't need to type anything. मैं उसको बोल के, I could get what I needed from the internet. We need similar things also in
Many
AI.
businesses were started, many things, it actually revolutionized.
Voice was a revolution when it met technology, I think. So,
right. So, but how do healthcare businesses measure ROI when adopting to AI tools? So an insight there would be helpful.
It's a buzzword right now. Everybody is doing AI. I think, it is now moving to the hard question of, is it advantageous to me also? And the other is, everybody is saying that, you're using AI. Everybody is, trying to integrate.
FOMO hai, fear of missing out.
अगर वो कर रहा है तो मैं भी कर रहा हूँ. But we need to be very clear कि ये किस चीज़ के लिए use किया जाएगा, इसका clear advantage क्या है, and does the benefit pass on to the hospital and the patient, and is there a differentiator for me? When I do this, I am differentiating myself from the others. The ROI question has been asked in other sectors. In fact, many sectors are now really looking at, is this just to write a letter to your boss in the morning कि I won't be able to come to work, you generative AI for that? Or is it substantially something that can help my business? And I think that analytics is still on. The question about what ROI will look like will need to be measured in 2-3 buckets, I think. One would be that you're using the power of technology to increase your efficiency, your processes become faster. The processes become safer, so I'm giving better advice, patients are getting better advice. And third is that ultimately it helps me saving some costs. So from a business perspective, if those three things are being benefited by AI, I think people will then adopt it. If not, it's just FOMO and it's just a buzzword. So
And what
we have
about
to
the
be clear.
workflow part? So
Workflow
like
part,
job losses is a major concern
it is.
related to AI.
It is.
So do you think that is
I don't think in
challenge
healthcare
there?
we will see job losses immediately, because we don't have enough healthcare workforce to begin with. So the intake of people will always be there. Do I foresee that in the next 5 years AI will replace a nurse? Not. I mean, seriously, not there. I mean, you could have some examples or some whatever. There could be some task shifting, which can also be very beneficial. I think we are only talking about job losses. That's a very extreme way of looking at AI. But what about task shifting? अगर मेरी नर्स को 4 बार एक ही एंट्री बार बार नहीं करनी पड़े,
Exactly.
मुझे वो फॉर्म जो मैं easily I can use AI to transcribe something, so that task shifting happens. Something that the AI can capture from the system जो मुझे जाके खुद नहीं करना. If I can just type in that this is the drug sheet and the AI will actually order it from the pharmacy, it saves so much time. And today we know healthcare में अगर आप देखें तो patients की सबसे बड़ी complaint रहती है, doctor didn't spend enough time with me, nurse didn't spend enough time with me. And these are realities because of just the way our workflows are. Can this task shifting to AI actually help that and reduce that friction that we have? So I would say job losses is a very extreme step, but what about the advantages that can come from task shifting and moving away mundane tasks that AI can handle?
So we did talk about AI literacy and trainings, but how do you think AI teaching about AI through the education system in the medical field can it do the wonder?
Yeah, I think it's very important.
Because as you mentioned that there are scarcity of doctors and nurses.
Absolutely.
So maybe teaching them AI in the very initial stages, already it is there in the 6th grade in CBSE school. So maybe that can be beneficial.
Absolutely. I mean, like the role of technology broadly, but AI itself. Tomorrow, a person who's getting into medicine today or is becoming a nurse or even an allied healthcare worker, 5-10 years from now when they will be treating patients, AI would have advanced far more than where it is today. Maybe it will be revolutionary, and it will be. At that time, does that doctor have the basic understanding of AI and know how I can use AI to help? It might become the new stethoscope. AI might become your new stethoscope. If I use AI for diagnosis,
I could visualize that.
Yeah, for helping me to better use my judgment, then that is going to be a revolution. But if I don't use a stethoscope in my first year of medicine, I will not be able to use it at the bedside. And similarly, we need to take AI also into account.
Right. So my last question to you would be, how do you see AI in healthcare in the next 3 to 5 years?
I think it is.
And maybe some thoughts or vision to our audience.
Well, I think AI is going to be revolutionary. We should use it as a tool, and we should look at it like a tool. It is available to us today. It is the responsibility to all of us to use it responsibly. It is great to get a synthesis of information, to get a wealth of information, but always ask, where is that information coming from? What is the source that Chat GPT or any of these Claude or others have generated? Uska base source kya hai? And only then you should actually look at what it is reasoning as to be correct or not. You cannot replace doctors. You can help doctors becoming stronger by AI. So I think that doctor-patient relationship should continue, supported by AI and technologies. But I think in the next 3 to 5 years, we will be seeing an AI revolution in healthcare, and it will be broadly more positive. And I hope that it can help reach the masses and ultimately make healthcare for all a reality in India.
Making healthcare a reality in India, reaching out to the masses, and with some AI integration and good doctors and nurses. With that, thank you so much, Dr. Karan.
Pleasure, thank you.
For giving the inside experience of healthcare and how AI is being integrated into the system. Thank you so much.
My pleasure, thank you.
So with this was all from me in the AI Literacy Bridging the Gap series. Next week, we'll come up with a new topic, new domain, how AI is being integrated there. Till then, stay safe and be careful.